Important points regarding the inheritance pattern. So the questions, so explain the X-linked dominant inheritance. Next, explain the autosomal dominant disorders. Next, explain the inheritance in case of the autosomal recessive disorders. So in this video, we'll find the answers plus learn a lot more. So firstly, in case of the X-linked dominant disorders. So here, what is to note is that the females are affected twice. The females are twice affected than the males. Next is the affected female has 50% probability. So the female has 50% chance of transmitting the disease to her son or daughter. So has 50% chance for giving it to the son or the daughter. Next, the affected male transmit the disease to all his daughters and none of his sons. So in case of the affected male. So in case of the affected male, they transmit the disease to all his daughters. So all his daughters have the disease. Daughters will have the disease, whereas the son won't have the disease. Next, we look at the X-linked recessive. So in case of X-linked recessive, what we need to know is that the males are commonly affected. Males are more affected than the females. So, and the thing is that the females are the carriers. So carriers meaning they are unaffected. Next point is that the affected father. So the affected father will have all his daughters to be carriers. So the affected father will have all daughters as carriers. So all the daughters will be carriers and they will have unaffected sons. Next, in the female carriers, the female carriers have a 25% risk of having an affected son. Have 25% risk of having an affected son. And 25% risk for having a carrier daughter. 25% for having a carrier daughter. And 50% chance, there is 50% chance of having a normal children. Next, we move on to the autosomal dominant disorders. So ADD. So in case of autosomal dominant disorders, the vertical pattern in pedigree, the individuals of each generation, are affected. That is the parent as well as the child. And other thing to note is that the males and the females are equally affected. And the affected individual has 50% chance. So the affected individual has 50% chance of passing on the gene to the offspring. So has 50% chance to transmit the gene to offspring. So next is the autosomal recessive disorder. So the autosomal recessive disorder, it has a horizontal pattern in pedigree. That is the multiple members of the same generation. So multiple members of the same generation are affected and no affected members in other generation. So other generations are not affected. So this is a horizontal pattern in pedigree. Next is that the males and females are equally affected. So the males and females, just as even in autosomal dominant, the male and female are equally affected. Here also the male and females are equally affected, and the manifestations are only in case of the homozygous state. So only in homozygous state there is manifestation. So now to answer our questions. So we asked about the X-linked dominant disorder. So what happens here is that the females are affected twice as much as the males, and next what we saw is that the female has a 50% probability of transmitting the disease to the son or the daughter. Next, the affected male transmits the disease to all the daughters. So it is transmitted to the affected male. So the affected male, they transmit disease to all his daughters. So in case the male is affected, in case of X-linked dominant disorder, so the daughter inherits the disease, but none of his sons. Next, we look at the next question was, what is the autosomal dominant disorder? So what we need to know in dominant disorders is that it has the vertical pattern in case of the pedigree. That is, individuals are affected of each generation. That is, the parent as well as the offspring are affected. So here the male is equally affected like the females. Next is the affected individuals have 50% chance. So there is 50% chance of passing on the gene to the offspring. Next question was in case of autosomal recessive disorder. So autosomal recessive disorder, it has a horizontal pattern of inheritance. So horizontal pattern means that in a case of a single generation is affected, whereas the other generations are normal. So here again the male and the female, they are equally affected, and the manifestation is only in case of homozygous state only manifest.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.